So, uh, welcome to the lecture series of lectures of infectious and tropical diseases, and this is the 14th lecture, which I'm enjoying very much, and I hope you are enjoying it too. Uh, uh, tropical medicine, tropical medicine is now a growing subject, despite that it is classical in many ways, but because of the recent development in science regarding the research in tropical diseases, particularly drugs, innovative drugs which has been introduced have really turned the whole specialty upside down into the favor, towards the favor of the patients. So it's very uh, likely and very present that we are giving this lecture from a country which has shown to a great extent that if you provide the right weapons for control of tropical diseases, then you will achieve quite a lot. This lecture comes from Rwanda, Kigali, and we have seen that the provision of good water, clean water, and then adequate sanitation, and rise and increase in socio-economic status of the people. That will help a long way in controlling tropical diseases. So Rwanda is giving a living example, and it could not be more appropriate to give this lecture from this country. Elimination of drugs of tropical diseases, the train is running fast. So while I'm giving these lectures, I would like to invite the young doctors, young scientists and specialists, and students to come and join in the fight against and the elimination of tropical disease. So these are one of the major reasons why I'm giving these lectures. Secondly, because it encompasses a lot of specialities, the internal medicine, the parasitology, the entomology, and science of the scientific and uh, investigative procedures like parasites, ultrasound, CT. So the whole development of medicine is now encompassing tropical diseases for the betterment. Uh, Even in Africa, now we are calling Africa as the home of tropical diseases. Now we are seeing quite a lot, like the example of Rwanda. We are seeing quite a lot of elimination of these diseases. Okay, the last lecture was on geohelminths. And as we said, geo is earth, and the other name is soil transmitted helminth, is STH. And if you just in terminology, medical terminology, you say STH, it refers to what we are talking about is geohelminths, because it's related to the soil. And soil is contaminated by feces, because these are intestinal worms. So logically, eggs will pass in the feces, and the feces is kept in the soil where it is moist, where it is green, and the grass will keep the moisture on, giving the feces the liquid part or the soft part, and the eggs to develop right up. So that is the soil which is giving uh, the environment. Secondly, I would like to say that this is fecal, which is fecal-oral transmission, meaning that if you have a media like a hand, or if you are eating something which is being soiled by the feces in the ground, or even water. Sometimes you can have these eggs taken up. The second group of is through larval transmission, so that in some of the worms, like in Colistoma duodenale, the eggs will mature for a few weeks in the soil. They are not effective if it's taken up by human. So they hatch and they leave the rhabdidiform larva, which is larva, what we call L1, is not developed. So that will penetrate the skin. And so that's another way of transmission. And this is Ankylostoma duodenale and Nicator uh, americanus. The other worm which do the same larvae is Strongyloides stercoralis. I appreciate that these names are difficult, so this is why I'm, with the help of Arwa Work, now we are putting it on the slide. If you look into number two, okay, two from four, then this is Strongyloides stercoralis. Strongyloides stercoralis. And we'll come to strongyloides because now it's a worldwide worm, which is now very prevalent in many parts of the world with the immune suppression of the virus HIV, or suppression by drugs in patients who are taking drugs for cancer or transplant. So the another major feature, if you go up on the slide, this is a disease of children. It's 4 to 10, and there is on record that a child of 6 months had ankylostoma duodenale. So it's 4 to 10, and this is have a significance in transmission and in control, because once it's measuring in children 4 to 10, then what will happen is this is a target group for treatment, a target group for education, and then a target group for follow-up, because luckily most of those children are between 4 and 10 are in school, so we can see them all in one go and we can educate them. So it's 4 to 10. As people grow older, the infection is less and less. They secrete eggs, but not as what happens in the children. Child might pass up to 50,000 eggs a day, because these worms, one worm can excrete about 2,500 eggs per day. So if you have so many, then you can see how much egg burden, what we call egg burden, in the feces. So it's a disease of children. Secondly, the other major feature is reinfection. Once you treat the child, very easy to treat the child. You can even treat him to cure, but he gets reinfected. He goes to the same soil, getting the same material, getting the same eggs or larvae, and then get reinfected. So this is a major problem of control, of difficulty in controlling these type of Geohelminths infection. So the symptoms are, these are general symptoms, and these are specific symptoms to particular worms. The general symptoms, one, asymptomatic. This is important because nowadays we clearly know that the number who are presenting with worms is far less than the total number. So many of the patients are asymptomatic. And this is important because they secrete eggs and they maintain the transmission, but they have no symptoms whatsoever. However, some of the children, or generally, even if they don't have symptoms, they have three parameters or three symptoms. One is stunted growth. And this we have shown that if you give albendazole, which is a drug of choice, then students, their growth will spare up. Secondly, the anemia. There is anemia of chronic infection. And you remember that anemia of chronic infection is normochromic normocytic. Okay. The third is impaired cognitive function. Impaired cognitive function meaning that they do less good in the school. So if you really treat all students, all children, then they do well as far as growth is concerned, as far as anemia is concerned. Okay. Uh, but we do have particular symptoms relating to the different worms. A notable example, which we are going to deal with this session, is ankylostoma. Ankylostoma is hookworm, and we have what we call hookworm anemia, and this is iron deficiency anemia, as we're going to see, because the worm sucks blood and causes ulcerations, which causes bleeding, and causes also inhibition of factor 7 and 10, leading to more bleeding. So this is a specific problem. With ascaris, we have already seen that they can form a bolus or a ball in the intestine and cause intestinal obstruction. So there are general symptoms which are shared between most of the worms, and there is specific symptoms which we deal with when we talk about the specific worms. So it's X direct, and autoinfection is another problem. Autoinfection, particularly for Enterobius vermicularis. This is Oxyuris. This is a very simple worm. You take the eggs, then develops into adults in the cecum. They rest in the cecum, but they can go all over the colon. And particularly pregnant worms will want to lay eggs outside the anus. They go through the anus and they lay eggs in the perineum, and they give massive itching. It's very unsocial to see somebody who is itching around that area. But they can do, and by so doing, they can take the eggs in their fingers or in the nails or in the nose and underwear, and then they can swallow it and get the infection again, simple infection. The important to remember about Enterobius vermicularis, the eggs are mature. When they get into through the anus, they are mature to get reinfection. Unlike the other worms, which have to stay in the soil for some time. So this is a nuisance, what I call a nuisance worm, because it doesn't cause a lot of problem apart from lower abdominal pain, sometimes bleeding, serrations of the colon. But the major thing is worm, and we have dealt with how transmission can maintain itself within a closed circuit, within a family, within the schools. People are just passing the eggs from one to another. Um, so it's the disease is definitely related to worm burden. Okay, the other thing is itch. Uh, if you if you just this is I put it not related, which is avian schistosoma. This is what we call a swimmer's itch. And those who attended schistosomiasis, this is avian schistosomiasis. It's bears in bears, and the bears will drop their cercaria, eggs and cercaria into the big lakes like Michigan lakes in USA. And once people get into swimming, they get bitten by the cercaria. But the cercaria dies soon after it gets into the body, but it causes severe swimmer's itch. It doesn't go into adult worm, but it causes a lot of economical problems because people will refrain from coming to these ponds for swimming, and that is causing a lot of stopping the business around it. So that's what we call a swimmer's itch. And then there is an anal itch, which is intro and that is enough. Like in ascaris, we may giving it more also, like in toxocara. Okay. And sometimes you need to repeat it for a long period. In Tropius vermicularis, although it's a simple one, but because of the reinfection, we can repeat it almost every week since it has a very impressive margin of safety. Sometimes you need to give ivermectin as well, and this is will be discussed when we discuss the worms, individual worms. Okay, so this is just put because of the terminology and of the spelling. I'm putting ascaris, which is called a roundworm. It's really rounded, nematode. And you have Enterobius vermicularis, which is oxyuris, and this is called pin or threadworm. Trichuris, trichura, tricura is called whipworm, and we're going to see pictures of that. And then ankylostoma, which is hookworm. And then we have strongyloides, stercoralis, strongyloides stercolaris, and this is what we call a worldwide worm, particularly now with AIDS. It's complicating AIDS, complicating patients with suppressive immunity. And then we have the dog or the cat worm, which is Toxocara. Toxocara canis, which is Toxocara worm, adult worm in dogs, or Toxocara cani, which is in cats. And this is again wide, maybe all over the world. So we have two. The last two is Strongyloides, is all over the world, and Toxocara canis and catis. And maybe that the Toxocara in Europe now, when we talk about seropositivity for Toxocara, it goes up to 15%, which is a real infection in Europe because now the dogs and cats have replaced children in many families. Okay, next. So it's important to look into the whole pattern of uh, uh, the worms. This we can see. You can see later. Mm, okay, the picture is not very clear. The picture of the speaker. Okay, we'll get the picture, the photo, and then we slice as we go on. Okay. So this is clear. Okay, next slide then. This is just pictures of this. Just brings home the colors. Okay, ascaris here on the left side. This is ascaris. It's a round worm, and you can really think it's a round worm. On the right side, you have the Enterobius vermicularis, which we say this is the Nelson's worm. It's called pin threadworm next. And then we have this is Ascaris lumbricoides again. Okay, it shows how rounded it is. Next. And then here it's, I'm taking this picture from a book called Manson's Tropical Medicine. And Manson published this book in 1821. 1821. So it's somebody who is he's the father of tropical medicine because he is the one who discovered that the mosquito transmits Wuchereria bancrofti of lymphatic filariasis. And he is the one who discovered intestinal schistosomiasis, which is named under his name, Schistosoma mansoni from Manson. So from the book, I got this because we have beautiful slides back home, but as you know, there is no access to these slides now. So I'm borrowing these books and I'm clearly saying, putting that on record. So this is the intestine, which have coiled ascaris, and this is called intestinal obstruction and patient had a fatal intestinal obstruction, and this is a post-mortem showing that the worms, Ascaris worm, is just making a ball. Okay, next. This is the Enterobius vermicularis. This is different worms. These all are nematodes, you remember. Next, this is called threadworm. Then we want to talk today about trichuris, whipworm, and ankylostoma duodenale on the right side. Okay, one phenomena which is curious is what is called geophagia, geophagia, which is G-E, geo from earth. Phagia is pika, like pika, eating air, eating the earth. يعني يقول لك الأطفال ياكلوا الطين. Okay, and this is one way of transmission, which is important. I don't know what is the reason of this pickle or Geohelminths, but I'd like to ask Professor Ali Arabi if he's with us, just to give us some highlight on the Geohelminths. So if he's there, he can make this clear to us. Okay. Ankylostoma duodenale. Ankylostoma duodenale is what we call, this is trichuris, we'll come to that later. Okay, next, you just give the picture before the speaker. So ankylostoma duodenale is hookworm, okay? And there are two systems for hookworm. One is ankylostoma duodenale. This is the one which is present in Africa. And then we have Nicator americanus. Nicator americanus. These are two types of hookworm which do the same pathology. They are almost sisters. Just one of them, they have some morphological differences you should come to see. So it's the hookworm is it's originally in lower in South Europe and North Africa, but then now it is spread in Africa, Asia, and other areas. Nicator americanus are still in Africa, and but in America, like Caribbean, all right, America, South America, up to now, USA has this type of worm, and so it is a worm which is known for a very long time in temperate climate. And in Europe, it used to be in mines, coal mines, when there was active mining of coal. The Ankylostoma was found in the mines, very humid and wet, and people may be forced to defecate because it's about a few hundred meters below the ground, which is not easy to come out. So that is the ankylostoma. And if you read the biography of the President Jimmy Carter, a great human being, he describes in his book that he reigned as a president of USA in 1979. But in his book, he describes the fact that they used to walk barefooted. And this is one of the things which will invite the larva. So they used to walk barefooted. And he described ankylostoma, said that many children, in particular black, have ankylostoma infection. And he knew it because his mother was a nurse. So he knew that. So this is a report from old USA when Jimmy Carter is now over 90. So if you subtract that, you can see when was he a child. And that is in Plains, a village called Plains outside Atlanta, Georgia. So it's resident, it's endemic in that area. So it's the worm is contracted by the larvae penetrating the leg, and if the child goes barefooted, then this is a way to contract the worm. Okay, and once it gets in the blood system. It goes around, gets developed on the way, and then gets into the liver, and then gets into the lungs, and then gets into the bronchi, bronchioles, bronchi, trachea, and then jump over the epiglottis to the esophagus, just like the Ascaris scenario, which is circulation. So in that, you can just imagine what are the pathology that can be caused by bronchiolitis. I have to emphasize that the pathology in many cases is different from those who are in an endemic area, have been exposed to that one before when they were a child, or through placenta, they are desensitized, so not like those who are coming from outside, they have these allergic or sensitization or immunity raised scenarios or symptoms more than the others who are in endemic. You remember when we talked about schistosomiasis, we talked about Katayama reaction or Katayama disease. This is very severe lung disease with fever, asthmatic type, which occurs with cercaria with once Serkeri gets into the lungs, then it can cause a lot of problems. This is only occur in expatriates. So here may be the case, but I will describe what it is possible, what will happen. So if you talk about ankylostoma, we talk about three stages. Stage one, which is the penetration, and then stage two, when it goes to the lung before it creeps to the esophagus, and then stage three, when it is mature in the small bowel. So we already dealt with the itching, which we call ground itching. This is very severe. It can not only on the day of injection or penetration, but it can continue for up to 7 or 10 days being itching. It causes vesiculitis, vesicles, all right, and uh, becomes purulent and becomes like a small ulcer. This goes in 10 days, and the patient may not have noticed it, but it goes on for development, complete development. So we second stage is when the larva reaches the lung, and this is can be very severe. Number one, it can cause cough, asthmatic type attack, and they have mucoid sputum, and the patient may be ill with fever and prostration or constitutional symptoms. So that's stage two. Stage three, once it goes in the esophagus, it rests into the stomach, being unaffected, and then rests in the small bowel. In the small bowel, it anchors itself. It has teeth, so it anchors itself in the mucosa like that, and then only its head attached, and they have teeth like sharp, very sharp teeth like nails. Okay, they get into the stomach and the intestine, and then this is causes ulceration and obviously bleeding, and the bleeding is maintained by the excreta factor, which inhibits factor 7 and factor 10. This is why the bleeding may continue. The second way of sucking blood, and it has been found that it has an impulse sucking. The worm has an impulse sucking of blood, and they do this 200 per minute, which even the small amount they suck when it for many worms and for a whole day, it means that there is a substantial loss of blood. So two ways of losing blood, and these patients may have melena, giving an evidence that the blood is being uh, out from the intestine. Okay, so it's anemia, and this is the classical iron deficiency anemia due to loss of blood. That is, it's a microcytic hypochromic anemia. Serum iron will be low, serum ferritin will be high, And it's showing this picture very clearly of iron deficiency anemia. And it is an important cause for iron deficiency anemia in the tropics. Okay. And it is very easy to treat. Very easy to treat. Something, as anemia and cholesterol. If you give them albendazole and then you correct the iron deficiency, the patient becomes very well because anemia can be severe. So it has all the symptoms of anemia. You remember, anemia can cause palpitation, anemia can cause breathlessness, lassitude, fatigability, and if it is very severe, it can even give heart failure anemia. It's on the record cases who have a hemoglobin less than 2.2 grams. So it can be severe. Okay, so it's anemia which will respond to the iron supplement. Once you give iron supplement, there is activation of the bone marrow. Okay, so the bone marrow will require folic acid because reproduction of RBCs will require all the essential elements. So there is a relative deficiency of folic acid because the bone marrow is very active. So it is advisable to give iron tablets. Iron may be by injection if you like, iron by or dextran, that is if you like, total iron infusion. But whatever you do, you give iron and folic acid. And then obviously you give albendazole so that you are treating the source and you are treating the symptoms of the anemia. So it's that is the iron, which is the major problem with ankylostoma duodenale. But there is also loss of protein. This worm causes loss of protein, and it's thought it is due to enteropathy, that is malabsorption, protein enteropathy due to malabsorption. So that's the way. There is transmission, obviously, we said it by the larvae, but sometimes they say lactogenic transmission from mother to child or through the milk and so on. But generally, if you just remember that it is a filariacidal, filaria, filaria, which is the rhabdative form which comes from the egg, penetrates the skin. That is good enough. So, what else about this ankylostoma duodenale is that it lives in the soil for a long time, and that is part of the importance in elimination. Because unlike other worms, the eggs can stay there. They need moisture, as you said. They need organic materials to feed on the larvae. And the larvae can remain in the soil for 1 year. For 1 year. That is very serious in terms of transmission, that you are reserving the virus for that long time. And they can dig inside to maintain themselves if there is any dryness. One thing about dryness, for all these worms in the soil, they cannot stand dryness. They need moisture, okay, to keep themselves on, and the feces will be in that moisture. So this is why we don't find these worms in deserty land of deserty countries. So, and the other feature which in the diagnosis, apart from seeing the eggs in the stools, is xenophilia. Xenophilia is a remarkable present in all worms, in all intestinal worms. And it reaches in the hookworm, it reaches up to 14%, 14% of the white count. So it's an important indication of the worms. So worms can be seen as a single worm, or it can be counted, what we call egg burden. And this is important because then, when you give treatment, you would like to see how many worms have died or have been killed. by the egg burden. And this could be done by what we described some time ago as cats. Cato, K-A-T-O, cats dash cats, the two people, Brazilian people, cats, K-A-T-Z. Cato cats is a quantitative measurement of eggs, and not only for intestinal well, but also for schistosomiasis. We can measure the burden of the eggs. Okay, PCR can help in detecting the worms, and then when once you give iron therapy and folic acid, you have to measure reticulocyte count. The reticulocytes are the precursors of the RBC, and once they are dished in the blood stream, meaning that the motor is very active, making RBCs, and to the extent that it is flooding from the bone marrow to the prematurely to the blood circulation, and reticulocyte count will be high uh, after 1 week. If you give iron and albendazole, after 1 week you do reticulocyte, you'll find it high. This is indication that there is a good response for iron therapy. So this is important in that albendazole given once may be repeated, giving iron therapy, giving folic acid, and then follow up the patient. If he's away then from where the infection is, then you can follow him to cure. Unfortunately, these most people will stay there and they get reinfected. This is why we talk about the control as a health problem by giving the school children or school age children who are not in the school but outside, this should be given albendazole regularly, like every 6 months. And then this will help in controlling the rate of infection and the burden of infection, the morbidity. So that is ankylostoma. So in summary, ankylostoma duodenale or Necator americanus is hookworm, and it is contracted by the filaria or the larvae, which goes in the skin barefooted. It circulates, it causes some lung problems, and then rest in the intestine, giving you anemia of the iron deficiency type, this which can be treated by albendazole, but prevent reinfection. So that's as far as ankylostoma duodenale, and the loss of blood. You have to remember that there is loss of protein as well, and the factors which will increase the loss of blood, which is the inhibition of the coagulating factors. So that is about ankylostoma duodenale. And now I would like to talk about a worm which is widespread, which is Toxocara or Toxocariasis. When I say iasis, meaning disease caused by the worm. If I say Toxocariasis, meaning the disease which is caused by Toxocara. These are worms which adult worm of cats and dogs. Man only harbors the larvae. So the pathology is caused by the larvae of these worms in human, but the worm is very similar to Ascaris. It inhabits the intestine of cats and dogs. This is what we call Toxocara canis, which is in dog, and then Toxocara cati in cats. And these are common infections. It's true that people in Western world, although they are harboring a lot of these dogs and cats within the house, and you remember that these they don't produce children because in Europe now the rate of production of children is 1.1, something like that, per pair of male and female. So, and many of them will have dogs, and these dogs are highly respected, and then some of them are even higher, air like Weritha. They people will donate the money after their death to the dog. So, and very fashionable in Europe to say, I'm walking the dog now, giving him exercise to walk. And this is the problem here because they walk in grass, they work in playing grounds of children, and they defecate. I'm always surprised in Europe to see somebody who is taking the dog out, and then the dog suddenly stops to open its bowels, to defecate and urinate, and the man will look at him like that, and then they leave everything behind. So it's what is now common feature there. So this worm, Toxocara, is adult worm which lives in these animals. It does not live in human. So human will catch it, the eggs from the feces of the dogs or the cats. Okay. It is worldwide, we said, and this is by serology because it can be asymptomatic and it's only showing itself in serology, which is like detecting antibodies of the larvae in human. And it goes up to 15% serology being positive in Europe and maybe up to 40% in Africa. So it's a disease worldwide. Okay. The important thing to remember is that it has a transplacental transmission. So the mother will pass it to the babies of the dogs and cats. The babies newborn of dogs are called puppies, and those of cats are called kittens, kittens, and puppies. And these are the greatest excretor of this world because they have been transmitted from mother or their mother to the puppies and kittens, and then they develop to produce adult worms, and then the kittens and the puppies will secrete eggs the day they are born. So it's it's a curious, a very curious worm. Uh, in matter of fact, you can have the whole cycle within a house or within a flat. If a kitten or if a cat is being brought in, certification, and then the feces goes on the fur of the cat, then and if you play with the cat and then you take the eggs and then you swallow it, then you can get the larvae in your body or in his body, and then gets all the complications for the larvae. So within the flat, the whole cycle, transmission cycle can be completed. And these worms, if you would like to know a size, it's around about the male and female, almost like the same size, is 6 centimeters. So it can even be seen by naked eye. So it's what does it do? What does it do? It's in the majority of patients, it's asymptomatic. It's asymptomatic. Once you see, you see an odd feature in the eyes or in the liver, then you examine the serology to find it positive for Toxocara. And so it's asymptomatic is the major non-presentation or presentation found by chance. Okay, the eggs will go into the intestine, okay, and then they hatch, giving larvae. The larvae circulates in the body. Okay, they go into the liver, to the lung, to the brain, largely because the number is not very great. The body does two things. One, kills the larvae and then causes a small granuloma in the organ where it was killed. Okay, or arrest their growth. So the larvae will be arrested at the same age, and it can go up to 1 year being arrested. They never grow into adults. And these worms can cause some changes, the liver, they can cause granuloma, and then they cause, if there are many, they can cause what we call millet picture. Here and there, you can find like a millet or قمح ولا كده in the liver. Okay, in the muscles, they go into the brain. To us, the most important organ which is being attacked by the larvae of Toxocara is eyes, the retina. Okay. What will happen is the rest behind the retina, subretinal granuloma will develop, subretinal. And then this, if you look on the ophthalmoscope in the retina, you feel a bulb in the retina, which mimics retinoblastoma. So it's important as a differential diagnosis. But if it settles, it will settle causing choroidoretinitis. And if you have choroidoretinitis, then you have some blurring of vision, you can have diminution of vision, and it's usually in the center, near the macula. If it touches the macula, you can go blind with that. So it's something. But once the granuloma settles, and then uh, you have all the symptoms of that, like photophobia, blurring of vision, then the degeneration starts in the retina, giving you very classical picture of retina choroidal retinitis, and this will raise the suspicion of toxocariasis infection. Okay, and if you do serology, you will find it positive. So again, I would like to remind you of the high suspicion of toxocara if you have a lesion in the eye. During the passage of the filari in the body, you may have some symptoms, but not very great, and it is usually in the eyes, which we are very much interested. It is adult worm of uh, cats and dogs. Okay, we can detect by the ELISA, as we said, seropositivity. And ELISA, capital E, capital LISA, is enzyme linked, enzyme linked immunosorbent assay, ELISA. It is enzyme linked immunosorbent assay. So it has an enzyme and an immunosorbent or immune bodies which will be assayed, and then the seropositivity. However, the seropositivity will not tell you if this is a recent infection or a past infection. So you may have it now, or you may have it. It's an old thing, okay? But at the end of the day, if you find lesion in the eye, which looks very much like choroidal retinitis, then you have to suspect toxocara. Toxocara. So what is the treatment? The treatment is for the adults, worm, then albendazole can do it. But in humans, because of the larvae circulating, incubating itself somewhere else, you need a longer course of albendazole. And this is albendazole given twice, 2 tablets, which is 400, twice a day for 5 days. This is a prolonged, unlike ascaris, which we give for once. And this is, so once we give it for that 5 days, reinfection is less, secondary infection is less. So that is as far as this worm, Toxocara, the other Toxocara of Catis and Canis, and it's something which has to be borne in mind. because it's worldwide. Okay, the last word for today is what we call trichuris trichura. Can we have the picture? Okay, the left one is we already have the ankylostoma. This is on the right side, but the left one is trichuris trichura, and it looks like a whip. Whip. So the lip whip, what we call whipworm, whipworm. And if you see the tail, if you see the tail, it's very thin. You can see it. It's thin like a whip. Okay. But then it coils here like a hand of a whip. There's so that is so. Okay, so this is the hand of the whip, and then this is the whip. So this is called whipworm, and it's about 3 centimeters long, male and female, and man is can harbor the adult, and then X comes out of the feces. Okay. The same reasons for getting this worm is, soil infection, feces, lack of sanitation, lack of good water supply, and low socio-economic level. And this is very important to remember, because if you want to eradicate, then you do this, you face these problems of public health problems. Where does it live in the intestine? It lives in the cecum and appendix. It lives in the cecum and appendix, and has a funny way of staying there. In the folds of the mucosa, then they have a furrow within the, because they are very cunning. And then they go and penetrate themselves within through the villi and through the villi, and then they live there comfortably. Okay, they mature there, and they start dishing eggs in the pieces. And then when there are too many, they circulate in the whole colon, reaching the colorectal region, and then they cause ulcerations both in the cecum and in the colorectal region. These ulcers may bleed, they may mimic colitis, they have blood in the stool, they have mucopurulent, and they have abdominal pain. Abdominal pain very much like colitis. So once the eggs are passed in the stools, they found the soil, and with that, the circulation goes on into the trichuris trichura. Okay. Just like to emphasize again the geophagia, which is a pica, and children eat some of the worms, some of the soil that contains the eggs. And some of these worms will cause perverted taste. Perverted taste, meaning that the taste is clear now, and they may not feel the taste like normal people, and they may need something fancy to eat. يمكن زي الوهم عند النساء إنه they started liking things which are not here, like if they are not in an area with strawberry, they may like strawberry or whatever. So this is perverted taste, and this may invite them to eat this mud, which will increase the circle, which you can have more worms. And it is important to remember that people can harbor more than one worm, up to 3, 4 worms, because the mechanism of transmission is the same. If you take uh, a scaris worm, okay, you may also take trichuris worm, and what prevents them from development. They both develop in the intestine. Okay, so once they go into the colorectal region, they can cause dysenteric symptoms. They cause ulcer and dysenteric symptoms. Dysenteric symptoms is pain, mucoid, mucoid feces and blood. Okay, so that is one part. And the other part, it is notorious of causing rectal prolapse. Okay, we can see a child again from Manson's. This is okay. This is a proctoscopic view of trichura worms. Okay, so you can see that there is ulcerations. The picture is not nice, on the proctoscopy, meaning like rectum. Uh, so causing this picture of ulcers and development of mucoid materials, which is reflected in the symptoms of lower abdominal pain and dysenteric symptoms. When I say dysenteric symptoms, meaning that you have an urge, okay, an urge to defecate. What we call tenesmus sometimes. Tenesmus is by definition the urge of defecation. And this is commonly seen in bacillary dysentery. And once you go to the toilet, you don't feel like you have emptied your bowels. So this is dysenteric symptoms, blood in stools, lower abdominal pain. Next. And then this is a child who have rectal prolapse. The rectal prolapse is the rectal part of the intestine will find its way out through the anus. It pushes itself out through the anus. And once it is there, this is an emergency. You need to, because otherwise that part of the intestine may be strangulated. So you need to have an operation very rapidly to put it right. Otherwise, other symptoms is those of upper abdominal pain, which is epigastric pain, vomiting, distension, flatulence, okay, and weight loss. So these are the general symptoms. But as we have said on the whole thing, is that this is asymptomatic is general, as asymptomatic is general to all worms. Okay, would like also to stress some lactogenic transmission. It can occur, but not very, very much. Okay, I will now give the time from egg to egg or larva to egg. Okay, to show you that these worms need at least about 1 to 3 months. Okay, from egg to egg. Egg to egg meaning swallowing the egg to the production of egg in the patient's feces. So for Enterobius vermicularis, which is called oxyuris, which I call it Newson's worm, you need 1 month. If you take the eggs today, then the eggs will hatch, larvae, adult, and then copulation, production of eggs, you need 1 month. This is a rapid one. And then Trichuris trichura is a difficult like this one we're showing. It needs about 3 months. Okay. Ascaris needs about 2 months, eggs to eggs. Ankylostoma duodenale larvae to eggs is 1.5 months. Larvae to eggs. Strongyloides again is larvae to eggs, 1 month. So the ankylostoma and strongyloides is the larvae penetrating. Okay, so it's the treatment of just trichuris to finish it up. Trichuris again is given albendazole. Okay, and it is something which it needs more care. Albendazole alone is not active. It can be repeated daily for 7 days, and then you see the effect. Or you can augment it by ivermectin. So with ivermectin, albendazole, and ivermectin, both of them are very well tolerated, and they do good. and combination is important here. You remember, I have always been stressing albendazole, maybe like extending it from a single to 7 days, whatever. But here, tricura is shown that the response to albendazole alone is not satisfactory unless you give it prolonged. And it is better combined with ivermectin. Remember, ivermectin is a drug of choice for onchocerciasis or liver blindness. So that is for albendazole. Okay, next lecture it will be strongyloides. Strongyloides. This is the adult one of Trichuris tricura, which is again from Manson's book. Okay, and so it's called whipworm. Okay, we have already shown it, and described the whip and the hand of the whip. Okay, strongyloides, back to strongyloides. The importance of strongyloides is that it is worldwide. It's not restricted to tropical strongyloides. Okay, because it can complicate HIV or other immune suppression because the larva can go and circulate for the room. So we'll talk about it next time. And maybe that I will find time for a disease. I will give you a quiz now if you take it home and think about it. This disease it's an infectious disease, okay? I'm not talking about strongyloids, okay? I'm talking about something else which I may find time for it next week because strongyloids will take about 15 minutes and then we'll go into this disease. So this disease is being reported, first described in 1981 in 5 people, who have the very similar symptoms, and then it is spread to other areas in the States, mainly in the States. Okay, and then they found that these different cities where the disease appeared in the males of these patients of the males have been to San Francisco for a party, so they may be that they contracted something. So then it appeared in Uganda and what is called the slim disease. People once they have a slim disease, reporting a slim disease, which is slightly different from those in America. Because America, the first presentation was pneumocystis carinii, okay, pneumocystis, which is like a fungal infection or near that. And it appears in people, special people, not all healthy, normal people. Okay. And then science improved our thinking about that disease. And now we are in controlling that disease. But there is 4,200 patients reported every day in the world. So this is a disease which we'll talk about maybe next time. It's an infectious disease. Please think about it, and if you know it, read about it, and then that will help when we give the next Sunday lecture. With that, I would like to thank Arwa, who is sitting beside me here, who prepared the slides, and would like to thank you all for joining me in this lecture. And I hope it has been useful and giving you more insight in the world of tropical disease. Thank you very much, and you keep well.